Hello everyone, today I'm with my patient. He did quadrilateral Precice, and quadrilateral means femur and tibia at the same time. He have Precice toenail. He's doing lengthening right now per day, 1 millimeter for femur, 1 millimeter for tibia. He almost reached
probably 7.5 centimeters. I'll have an X-ray on Friday, maybe 8 centimeters, maybe a little over 8 centimeters, not 100% sure. But in terms of the process so far, obviously every patient's going to be different, but the stiffness has definitely increased for me significantly, maybe the past week or so. So I was chatting with someone just a moment ago about how obviously the physiotherapist, Akin, head physio here, in the beginning it's inculcated, it's really pushed on you that you need to do your exercises, you need to stretch, you need to have that responsibility. But especially recently, it's not really a choice you have. It's a matter of if you don't do it, then you're pretty much not even going to be able to get out of bed. It's a matter of you have to now. So it's become a lot more work, especially. As I said, 7.5, maybe 8 by the end of this week, and my goal is 14, 15. So I know that it's only going to become much more intense in terms of all the...
tight.
Yeah, tight, and the physio sessions as well, they're becoming more active work. In other words, the initial sessions at the beginning of your lengthening, you know, you go in there and you're just passively stretched, feels good, you know, you have someone who's helping you with the movements, and but now it becomes much more active in terms of pain. It's more painful now, so you have to really allow yourself to absorb that during the sessions. You can't really say, no, that hurts, don't do that. You have to say, no, this is part of the process. The physio's painful, the lengthening's painful, and I'm only about halfway through right now.
Yeah, like you said, because it's getting tighter every day. For example, he did today lengthening. He feels tightness, but tomorrow he will do lengthening again. If he feel a little bit more tightness than today. And this is the process.
Yeah, so every time you lengthen, you don't just lengthen and then watch TV. You lengthen, and then you need to mobilize a bit. You need to stretch around that. Maybe, well, I'm doing the Precice, so I can have a hot shower. It's like hydrotherapy. You know, it's people doing the LON, they can't shower that way, but the heat on the muscles is good. You'll come up with your own routine and your own cadence as far as how you're going to lengthen and how you're going to manage the pain. I'd say 95% of my day, truthfully, is just pain management. So every patient's going to have different levels of pain. I've talked to some people, they say pain's not bad at all. My pain's pretty significant, which is surprising because I consider myself to have a pretty high pain tolerance before I started the process. I've considered myself I'm pretty tough with everything, but I've had a lot of pain, and so yeah, most of my day is just just managing the pain around the lengthening.
How we can manage the pain?
So obviously you're going to have the medications, but you need to be aware that it's really stretching and mobility. It's ambulating, walking around that is going to be best for your pain. That's a lengthy discussion in of itself, but just very important to always be walking, I'd say, minimum half an hour a day.
Yeah, you must keep every day, right? Every hours also. Do you think about the physiotherapy?
Well, you know, physiotherapy, it's vital. So minimum 3 sessions per week is what all the patients are going to be doing here. For quadrilateral patients in particular, it's recommended at least 1 session daily. Okay, so Sundays are off for physios, but you're talking Monday through Saturday, so 6 days a week. At least for most of my process, I've been doing 3 sessions per day, not per week, per day. Some days I have 2 per day. It depends on the availability of the physios. Akin is my main physio here. It's really about being able to be stretched in ways that you can on your own. So obviously the exercises you'll do on your own time, but physiotherapy, it's especially the dorsiflexion. The strength of the dorsiflexion is something I can't replicate on my own with self-exercises. So that's largely what I'm paying for in terms of the physio. It's very important. Everything's a lengthy discussion, but also the propensity for ballerina when you're doing tibial lengthening is you have to stay on top of things with the stretching. So, and it's not a matter of if the ballerina is going to occur, it's a matter of when. So if my goal is 6 centimeters minimum on the tibia, you know, maybe I can just stay on top of stretching and get to 5 centimeters if I'm lucky before I start to see ballerina. I'm not sure. I'm not going to act like I know everything when I'm not there.
Maybe
yet.
it will not.
Maybe it won't, right? I can feel the tension. So right now I said I'm at 7.5 centimeters, so maybe 4 on the femurs, 3.5 on the tibia. I've taken a few few days off, start taking weekends off tibial lengthening. There's more pain on tibia. I'd say 90% of pain for me is tibia, not femur. But having, the staying on top of the tibial lengthening is really important. The stretching for the lengthening process. So to prevent the ballerina.
If you are talking about the pain, what kind of pain? Can you say something about that?
A lot of the pain is mostly in the shins, I would say. So the growth pain. So initially you're going to have, right after your surgery, the first few weeks, swelling pain, surgical pain. And that's going to subside by about 2.5 weeks, 3 weeks out. And then I'd say the easiest part, truthfully, is 3 to 5 weeks after, maybe 3 to 4 weeks after your surgery, because the surgical swelling has subsided, but your lengthening is still early. And then you're going to feel the lengthening pain start, where your body will just tell you, like, I don't want to lengthen right now. I can feel pain. I don't want to do this, but it's why you're here. You have to stay on top of it. You're going to listen to your body, yes, but what I'm saying is, rather than just diving into the lengthening right away, I might say, okay, my body's telling me I have to stretch first. I have to have a hot shower first, warm the muscles up. I'm going to stretch for 15 minutes, then I'm going to lengthen. So as I said before, you're going to develop your own cadence. But staying on top of the tibial strengthening, the dorsiflexion in particular, really important for protracting the point at which ballerina is going to occur.
But until now, your body condition was really good. I mean, it was hard in the beginning, like you said, you have a swelling. That's why we was fighting with swelling. After control the swelling, you start to walk with crutches. I think you don't need the help to doing your daily routine right now, right?
Yeah, I mean, I would say probably the first 2 weeks, you're obviously going to need the most assistance in terms of the staff here, in terms of nurses coming to your room, people helping you out with basic activities of daily living, and then you'll be off the walker. Obviously, everybody's going to be different, but you'll be off the walker by about 2 weeks out of surgery, and then you're onto crutches, and that's a big milestone. And yeah, you'll just gradually notice your independence improving, and that aspect becomes easier, okay? So if these things are, they multiply into, the same outcome, is that the activities of daily living become more independent, but the stretching becomes more painful. That's what it is. So in the beginning, ADLs are more difficult, but your stretching is not as painful. I'm expecting the pain to increase as I get closer to 14, 15 centimeters.
We're almost halfway.
Yeah, halfway, and I'm expecting stiffness, pain to increase. But simultaneous to that, my plan is to, just make sure I am stretching the best I can, and yes, just having taken that responsibility and the initiative. It's understanding that it's work. It's understanding that you need to go to the fitness center here for maybe 15 minutes and walk on your own time, and make sure you're getting at least half an hour a day of mobility in.
And with Precice, he can use alterg also. It's really good for during lengthening, recovery, and at the same time lengthening part. It's really good without any support. Walking.
Some people are more fanatical about the alterg. I mean, obviously it's innovative, right? But I think I've had maybe 4 alterg sessions. I could have more, but I've had 4. I'd say the main benefit is increasing the cognizance of your gait. In other words, I might get on the alterg, and then Akin points out, look, you're coming down on the lateral aspect of your left foot. Can you try to put the medial aspect down a bit more? And so you develop awareness for your gait. And then when you're not using the alterg, when you're just walking on your own time, you say, okay, I have that awareness, that cognizance now, and I can try to walk, have better gait awareness, walk more properly, I guess. So I'd say that's been the main benefit for me. Some of the other patients are more further along, some who've finished in particular. They like the alterg really for improving their ballerina. That's one aspect I've heard. And
you reach 7.5 centimeter. And do you feel taller right now?
Look, I do feel taller, but I'd say maybe from the first 4 centimeters, the guessing game, by about 5 centimeters, you definitely notice that you're taller. In the mirror, you'll notice you look taller. But it's largely a blur because, as I said, 95% of my focus daily is just pain management. So, and the other patients here, they're lengthening as well. So you're not going to really notice yourself growing compared to the other patients per se. Even the staff members, I'm starting to notice that I'm becoming taller than some of the staff, but well, not Akin because he's 191 here. So we were joking before the interview how like none of the patients want to take photos with him because they're not, even their post-growth process, they're not going to be as tall as he is. You know, when I'm 185, 186, I mean, he's 191, right? So, but maybe I come back in a couple of years and I do another surgery. Maybe I do Precice again, femur in 2026 only. Maybe I get to 191, maybe. It's possible.
Why not? We have a picture together also.
Yeah. But yeah, you'll definitely, I'd say from 5 centimeters onward, / upward, it'll be undeniable that you're becoming taller. And sometimes people will make comments. Sometimes some of the staff will say, you're becoming taller. And you're like, really? Like, you have to say that, or you're just saying that. And you're like, no, really. It's like, you're becoming taller. And then, so that's one aspect. Another is you'll compare photographs. So I've had photos when I first arrived here versus now. And I'm like, wow, I can't believe that it really is happening. So, yeah, those elements are supported.
Are you happy with the results right now, until now?
Yeah, I mean, I wouldn't, if I'm 7.5 centimeters, I start at 171, so if I'm hypothetically 178.5, 179, I mean, I'm happy with how things are going. I wouldn't want to stop right now. So I'm just going to push the most I can, 14, 15 for the Precice, and I know it's going to be painful as I get toward the end, but I'm just going to do it. That's my personality.
We can do that.
I'm going to do it.
I'm sure.
And as I said, I'm doing lots of physiotherapy. Your actions have to match your ambitions, right? So if you're going to come in here and say you want 15 centimeters, then you better make sure you're doing extra physio sessions and you're doing a lot of mobility on your own time. If you're coming in here and you're just going to do 6 centimeters on femur LON and that's it, okay, well, maybe you don't have to be as active with the process, but it's a matter of what your goals are. And so some of us have big goals, okay? Obviously, I'm on camera here and I'm willing to talk about it, but there's others who are not willing to get on camera, but there's people here who have big goals. So.
Yeah, I think we can do 15 centimeter, but you must do your daily routine, and physiotherapy also is really important. Without physiotherapy, can you imagine?
It's the quality of the dorsiflexion. I emphasize this, okay? Because, I harp on this because physiotherapy, obviously there's massage element, there's different, yeah. So he's becoming ripped and jacked because he puts a lot of force.
Look, there's the purple.
He's doing. Yeah. But that's really the crux of it is minimizing the ballerina risk, protracting that part. I don't want that to occur sooner. So I'm really on top of the physio for that reason.
Thank you for all answers, and I'm sure we can reach your goal. Let's take another video, end of the part.
Sure.